Hello, I'm Keaton Helquist, and today we're talking about cultural competency for healthcare providers. The role of the interpreter is essential in a healthcare setting. This is of the first importance. Proper, clear, and accurate information is vital to good healthcare. Interpreters make it possible for patients to express their thoughts and experience to the provider effectively, and also make it possible for the provider to effectively communicate treatment plans, diagnostic tests, the purpose of procedures, and more to patients, which is essential for a quality healthcare visit. An important aspect in the role of the interpreter is considering which arrangement may be most appropriate for your patient. There are a few arrangements that are possible. Providers may choose to sit across the bed from the patient and have the interpreter immediately next to the patient. This makes it so the patient is less burdened in communicating, but it makes it harder for the interpreter to understand body language and to communicate that. Additionally, the patient may be confused as they have to look back and forth between the interpreter and the provider. Other arrangements include having the interpreter and the physician next to each other. This helps the interpreter to be able to see the patient and their body language as well. However, the patient may again be confused at which person to look at. What is important is balancing the principles of maintaining eye contact while allowing the provider and the interpreter to observe the patient and their body language and to hear everything they're trying to say. It's essential that we not allow family members to interpret in healthcare visits. This can lead to disastrous consequences, as we saw in the case of Willie Ramirez, whose family member interpreted the word intoxicado incorrectly. This led to the providers assuming that he was drunk rather than poisoned, as the word really intended. This slight misunderstanding led to disastrous consequences, and Mr. Ramirez was left a quadriplegic, paralyzed from the neck down. It is vitally important that we use interpreters who have been trained and are qualified to provide healthcare translation and interpretation services. Now, a few important skills for healthcare providers in terms of cultural competency. What's most important is to be accessible. Patients may not understand the cultural norms associated with medicine here in the United States of America. The check-in procedures for some patients may be foreign. They may be seeing paperwork that they've never seen in their lives in a language they've never seen before. Be able to have the forms in many different languages. Also, be sure to explain the purpose of labs and procedures. There are many procedures that are performed here in the United States of America that may be foreign. Be sure to offer culturally informed accommodations. When recommending diet changes or dietary modifications to adapt to a certain treatment or illness, be sure to include culturally relevant foods. It's important to fight the fundamental attribution error in caring for patients from different cultures and backgrounds. The fundamental attribution error asserts that people's outward presentation is due to internal traits and characteristics, rather than external environmental factors. For example, assuming that a patient didn't show up to an appointment because they're lazy and they don't care, rather than that their culture has taught them that it's not that important to be someplace at exactly the right time, rather relative time boundaries. Be sure to be curious and teachable in the process. That concludes today's discussion on cultural competency for healthcare providers. Tune in next time for more how-tos.